Hello, my name is Carly Hubert, and today I'm going to be doing a presentation on the human papillomavirus. Human papillomavirus is a viral infection that causes skin or mucous membrane growths on the skin. There are more than 100 variations of HPV, and some can lead to warts on the genitals, common warts on the hands and fingers, planar warts on the feet, and flat warts on the face, which are more common in children. HPV can also lead to cancer in the vagina, anus, penis, or throat. However, majority of HPV infections are asymptomatic. All warts are caused by HPV. However, not all strains or types of HPV cause warts. HPV can be conducted through skin-to-skin contact, enters the body through cuts, abrasions, or small tears, and it is the most common sexually transmitted infection that is obtained through vaginal, anal, or oral sex with an individual with the virus. The population of people that have HPV is 14 million people get the infection each year. Most sexually active people who aren't vaccinated against HPV become infected and never know they have it. Everyone has had or will have HPV at some point in their life, but most of the time it clears up on its own. HPV is most prevalent in adults. 45.2% of men from the ages 18 through 59 have genital HPV, and 39.9% of women in the ages 18 to 59 have genital HPV. Females have greater health risks from HPV, and high-risk strains can progress to cervical cancer. 20.4% of women have a high-risk genital HPV. The CDC says that 11,100 cases of cervical cancer per year are from HPV. The vagina has 700 cases per year. The vulva has 2,900. The anus has 4,700. And the back of the throat has 2,300 cases of cervical cancer per year from HPV. However, for males, there are fewer health risks, and 25.1% have high health risk genital HPV. Cancer in the penis, there are 900 cases. The anus has 2,200 cases, and the back of the throat for males has 12,500 cases of cancer that are linked with HPV per year, according to the CDC. The greater risk factor for obtaining HPV based on the number of sexual partners you have. The more sexual partners you have is the more likely you are to obtaining genital HPV or having sex with someone who has had many sexual partners. Ages are also more likely to develop HPV. Children are likely to have common warts, and adolescents and young adults are likely to have genital warts. People with weakened immune system are also likely to have HPV. Examples of individuals with a weakened immune systems are individuals with HIV/AIDS or that take immune suppressing drugs. Also, damaged skin is another risk factor for obtaining HPV. In order to reduce the chances of obtaining HPV, an individual can be abstinent or choose to get vaccinated before they're sexually active, preferably around the ages 11 to 12. If the individual is already sexually active, they may be able to still get the vaccine in order to protect them from other HPV strands that they haven't been exposed to. It's important to get screened for cancer with HPV screening or Pap smears at the age of 21. And if the individual is sexually active, it's important to practice safe sex by using condoms or be in mutually monogamous relationships. Although there is no cure of the HPV virus, strains of HPV differ in the body. Low strains of HPV, your body is likely to fight off the infection. 90% of HPV infections are cleared within a year or two. However, high strains, your body cannot fight the infections, so it is important to contact a healthcare provider in order to monitor any cell changes. That way, they won't lead to cancer. You are also able to remove any visible warts on your body by freezing them using a wire loop technique, burning off warts using chemical treatment or electrical current, using laser therapy or prescription creams to destroy any warts. In order to prevent cancer in the cervix, you can remove any abnormal cells in your cervix. And you also may be eligible for the HPV vaccine. Overall, human papillomavirus is a common sexually transmitted infection that can cause many health issues like warts and certain cancers, depending on the strain, if it's high risk or low risk. Most HPVs are asymptomatic and will clear on their own, and others can eventually turn into cancer. That's why it's important to see your doctor and get screened for HPV and get vaccinated, as well as practicing safe sex and other skin-to-skin transmission. I got all of my sources from the PowerPoint through the CDC, Cleveland Clinic, the Mayo Clinic, and 2 different sources, and then an article published on PubMed, NIV, and from World Health Organization. My goal from the presentation is to help spread awareness for HPV and to help educate people to get vaccinated and practice safe precautions.